serum markers of liver pathology as well as Reye syndrome. All right, so you have to know what to be looking for when you collect a CMP or BMP on patients that have some type of liver abnormalities, because they're going to give you all these values and you're going to have to understand how to interpret them. So this is where the serum markers kind of plays a role. So first we have our AST and our ALT. These are our liver function tests, okay? So it's aspartate aminotransferase and alanine aminotransferases. These are elevated in pretty much all liver diseases, and usually you're going to see ALT greater than AST. Okay. Now, one specific exception to that is an alcoholic liver disease. There's a classic presentation that will give you the answer, dead giveaway. If you have AST greater than ALT, usually 2-to-1 AST greater than ALT. So that means like your AST level would be like 200 and your ALT level would be 100. Okay. That is a classical sign of alcoholic liver disease, specifically alcoholic. Okay. And it normally does not exceed 500. Okay. So keep that in mind. In alcoholic hepatitis, it will not exceed 500, but you will have macrocytosis and a greater than 2-to-1 AST to ALT kind of ratio. That's indicative of chronic alcohol use. The macrocytosis is indicative of alcohol use because of usually alcoholics are malnourished and they don't usually eat anything. Okay, and so that can lead to vitamin and nutrient deficiency, which can lead to the macrocytosis. All right, next, if you see a severely elevated aminotransferases, like greater than 1,000, it usually is suggestive of drug-induced liver injury, like patients that are taking acetaminophen toxicity. And you're going to treat those patients with N-acetylcysteine, okay? So that is another thing that's really common for elevated, like above 1,000 aminotransferases. Very high. Next is alkaline phosphatase, ALP. ALP is elevated in cholestasis. So whenever you have any type of biliary obstruction, you're going to see elevated ALP. It also is elevated in bone diseases. So increase in ALP with no clear etiology should be followed by a GGT, which is gamma glutamyl transpeptidase. The reason behind that is elevated GGT, is going to be seen in biliary diseases as well as various liver diseases, okay, just as ALP can. But no bone disease has elevated GGT. So if you are confused, if you see an elevated ALP and there's no clear etiology, you have to get a GGT in order to rule out bone involvement, okay? Because if GGT is elevated, then you know that it's not the bone that's involved. It has to be the liver or the biliary systems, okay? An elevated ALK phos does not automatically tell you that it's a biliary or liver issue. It can also be a bone disease, okay? So I want you to know that. So follow it with a GGT if there's no clear etiology for the elevated ALK phos. Most of the time, there will be a clear etiology. Okay, next is kind of the functional liver markers, okay? So one, we have the bilirubin. If you have elevated bilirubin, then that's going to be obvious for some type of liver diseases or hemolysis, okay? And we know why, right? We can have direct bilirubin versus indirect bilirubin. And indirect bilirubin elevated, it could be, talking about hemolysis or some type of liver dysfunction. A direct bilirubin elevation, we're going to get to these pathologies later on, but it could be some type of obstruction later on down the road, okay? Some biliary obstruction. Next, you can see albumin decrease. The reason that albumins decrease in liver diseases is because, once again, the liver's one of main liver functions is to produce proteins. And one of those main proteins is albumin. So if the liver's not functioning well, it cannot produce the normal proteins, so you're going to have an overall decrease in albumin. And so then that's why you will see an overall decrease in plasma oncotic pressure seen in cirrhosis, and that's why you get third spacing and edema in ascites, okay? Next is prothrombin time. Well, prothrombin time, PTT, is going to be elevated in advanced liver diseases. And this indicates a very poor prognosis. So they're going to ask you, which of the following indicates a really poor prognosis for liver disease? And they're going to give you all of these markers. And the answer is going to be elevated PTT. The reason behind that is because you know that the liver has functioned so poorly that you have an overall decrease in production of clotting factors, that it's gotten so bad that it has now affected prothrombin time, okay? And remember that pretty much all of the factors, clotting factors, are made by the liver. I think like with the exception to 8. I mean, don't quote me on that, but who cares? But remember, sorry, not PTT. I said PT. I don't know if I said PTT, but the answer, it's prothrombin time. It's PT. Okay, so I don't know if I confuse you guys, but if PT is elevated, that is the indication for a poor prognosis, because that means that you have lost all production of clotting factors and it's gotten to a very poor point. Okay, remember it's PT, not PTT, sorry. And lastly, you're going to see an overall decrease in platelets for patients that have liver disease, because the liver produces thrombopoietin, and so that's going to be decreased. All right. So those are our serum markers. Remember, AST over ALT times 2 is going to be indicative of alcoholic liver disease. Patients with like ALK-Phos elevations with no clear etiology, you have to do GGT to rule out any bone involvement, because ALK-Phos can also be elevated in bone disorders, not only just biliary disorders. And then remember, PT elevation is an indication for the poorest of prognoses for liver disease. Now moving on to Reye syndrome. Reye syndrome is rare and very fatal in childhood hepatic encephalopathy, okay? It's a childhood hepatic encephalopathy. Okay, we discussed what hepatic encephalopathy was, right? It's going to be essentially the failure of the liver to do its job. Now, the reason behind this is because if you give a child aspirin, usually following a viral infection, okay? So a patient can have like VZV or influenza that has been treated with aspirin. The aspirin metabolites are going to decrease beta oxidation, and it's going to cause reversible inhibition of mitochondrial enzymes. That's something they want you to know. So due to aspirin causing mitochondrial damage, Reye syndrome is due to aspirin causing mitochondrial damage, leading to impaired fatty acid metabolism, which is decreased beta oxidation. Okay? So let me repeat that one more time. Reye syndrome is due to aspirin causing mitochondrial damage, which leads to impaired fatty acid metabolism. All right? Usually following a viral infection like VZV and influenza. So if you ever see a patient that's young getting aspirin, this should be on your number one differential. Okay? Now, what you're normally going to see, obviously, is mitochondrial abnormalities, but you also will see fatty liver, specifically microvesicular fatty liver changes. It's microvesicular steatosis, which is microvesicular fatty changes. Steatosis is just fatty changes. So it causes microvesicular fatty changes. And you'll see why I'm making a really big point on that. Okay? And then it also will lead to encephalopathy, which is diffuse astrocyte swelling. Okay? So the patients will have microvesicular steatosis and diffuse astrocyte swelling, which is encephalopathy. So avoid aspirin in children, except for one disease, and we'll talk about it in the vasculitis section, but it's Kawasaki's. Okay? You have to avoid it in patients, in all pediatric patients, unless the patient has Kawasaki's. Okay, so once again, you're going to see microvesicular steatosis. You're going to see patients with encephalopathy, like in a coma. It's usually going to follow a viral infection like VZV and influenza, and then the patient received aspirin due to that. And then the aspirin causes mitochondrial damage, leading to impaired fatty acid metabolism. All right, I don't want you to miss a single question on Reye's. Okay, that's pretty much it for serum markers in Reye syndrome.